licensing creates a regime where individuals have to seek permission from their state government to start working. And, I think once I start talking about some professions, if I'm talking to a group of business students or business leaders, I can usually start talking about certified public accountants. And, there's probably somebody in the room that isn't really happy with the status quo.
Hello, welcome again to the episode of the Let People Prosper show. My name is Dr. Vance Ginn. I hope you're having a prosperous day. Well, today I'm delighted to have on another guest who knows a lot about occupational licensing, barriers to work, and how to free people so that they can prosper more. And it's none other than Dr. Ed Timmons. Ed, welcome to the Let People Prosper show.
Good to be on your show, Vance. Thanks for having me.
Well, it's my pleasure. We've known each other and been friends for a long time, so it's good to have you on. You've been doing a lot of great work across the country. And so I really wanted to talk to you about this because this is something that kind of goes underneath the radar a little bit with occupational licensing and labor regulations, but it influences people's lives every day, especially kind of the neediest among us. And so let's get into it. But before we do that, let me give the audience your bio, and that way we can jump right into this. So Dr. Ed Timmons is a service Associate Professor of Economics and Director of the NE Regulatory Research Center at the John Chambers School of Business and Economics at West Virginia University. He completed his PhD in economics at Lehigh University. He is a senior affiliated scholar at the Mercatus Center and a senior research fellow with the Archbridge Institute. His research has been published in scholarly journals, including the Journal of Law and Economics and many others. He is regularly asked to provide expert testimony in state legislatures across the United States on occupational licensing reform and the practice authority of nurse practitioners. He has also authored numerous articles in the popular press, just many of those as well. So, Ed, with all of that, let me start with this question that I ask all the guests first. What motivates you to do what you do every day?
No, thanks, Vance. And that's an excellent question. When I first got started, I originally thought that much like many other professors that I'd be doing research and I'd be teaching students, and I still enjoy doing all of those things. But I had the opportunity to connect with the Mercatus Center pretty early on in my career, and they let me know that there's more opportunity to spread the word about the work that you do and make sure that your research is impactful as it can possibly be. So I had the opportunity to do more dissemination of my work through op-eds and through testimony. And it really got me passionate about this issue of making sure that there aren't unnecessary barriers for folks that are looking to get started in a career. And occupational licensing just seems like one of those where it's really hard to justify, and there's very clear costs associated with it. And I'm very passionate about occupational licensing reform. It's become my life's work.
Yeah. And you've been doing a lot of great work. I mean, you're senior fellow at some of these places, but you help out with a lot of other think tanks across the country. You and I have done some research together whenever I was at the Texas Public Policy Foundation. I know you've done some work at the Pelican Institute in Louisiana. So you're all over the place. So you're the man to talk to about occupational licensing. So how did you get to where you are today, though, Ed? I mean, you talked a little about Mercatus. You're in academia now, but were there any sort of kind of tipping points or institutional changes, if you will, that got you to where you are today?
Yeah, I mean, I think one big signal to me that it was really time to kind of grab this issue and run with it a little bit more was back in the summer of 2015. The Obama administration put out a report that really highlighted the issue and made the issue what I would qualify as a nonpartisan issue. And with the publication of that report, I thought the time was right to set up a new research center that was focused in on this topic. And my thought at first was, let's just, thinking about it like an academic would, let's just improve data. Let's see if we can generate more research. And obviously, I still want to do that. But since then, the mission of the NE Regulatory Research Center has really been to serve as a resource for disseminating the work and all that we know about the effects of occupational licensing and making sure that policymakers and those that are engaged in public policy have access to the information that they need so that policy can be informed and hopefully real change can move forward.
Yeah, that's great. And I remember that paper, the report by the Obama administration. And what's interesting about occupational licensing is that this is really a bipartisan issue. In many ways, it should be nonpartisan. It should just be, look, this is good public policy. And I want to get into some of the details about that here soon. Why, I think these are good reasons for why you got into this area. It's become your life's work, and it's helping people across the country in so many ways. Are there particular assumptions that you have within your set of, some people call it economic schools of thought, or other sort of priors that go into your thinking and your assumptions for your work? Do you have some of those, or how do you think about that?
Yeah, no, I mean, I'm generally of the mindset that if individuals want to get started in a new career or get started in a business, that there shouldn't be artificial barriers. I mean, there shouldn't be protections for the incumbents that essentially shelter them from competition and make it more difficult for new entrepreneurs or new workers to get started. I'm very much of the persuasion that there should be equal opportunity to get access to the labor market, to get access to becoming an entrepreneur and getting started with a new idea. And, certainly any artificial barriers that get in the way of folks doing that don't really seem to jive with everything that makes America great. Yeah,
great points there. So let's get started then about occupational licensing. If you meet somebody walking down the street and they ask you about occupational licensing, how do you explain it to them in a way that they'll understand while also grabbing at their heartstrings of why it's important?
Yeah, no, that's an excellent question. And, I think the simplest way that I've heard it broken down is that licensing creates a regime where individuals have to seek permission from their state government to start working. And, I think once I start talking about some professions, I mean, if I'm talking to a group of business students or business leaders, I can usually start talking about certified public accountants. And, there's probably somebody in the room that isn't really happy with the status quo. Or, if I'm in a room of folks in medical professions, I can talk about the scope of practice restrictions that might prevent them from working to their fullest potential. So, I think it's a fascinating topic. And I think, as you said, it's one of those topics that when you initially say occupational licensing, it causes people's eyes to glaze over. But, once you start getting into the specifics and people have an understanding that this is a big labor market institution, I mean, we're talking about 1 in 5 workers, perhaps more than 1 in 5 workers in the United States that are directly affected by this. And they start to get a grasp that either they themselves have encountered it or they have somebody that's a close friend or a family member that has encountered some of the challenges. Maybe they know somebody that's moved from one state to another and has encountered all the challenges with trying to get a license transferred. I think it doesn't take long once you start talking about the topic to really grasp or to really get at people's attention and make them understand the gravity and the importance of the topic.
Yeah, that's true. And I wonder, too, whenever you're thinking about occupational licensing, the effects of it. I mean, some of those that come to mind are cosmetologists are licensed. In Louisiana, florists are licensed. And it's kind of taking a step back. I think the impetus or the reason why government thinks they need to get involved, I guess, is because there's a market failure, that somehow the market isn't going to price in the cost to people, the health, the society, or the environment, that there's some sort of other effects that are not priced into that market. And so the government needs to signal to us that this person knows what they're doing and that they're not going to hurt our health or something else. And it kind of brings up these questions about cosmetology, right? Why are they licensed? I mean, if they don't cut my hair well, then I just won't go back. Maybe they might clip my ear or do something else that's harmful, or maybe some of the chemicals that they use could be harmful. But wouldn't you just not go back? Like, don't we also, as consumers, have a lot of control in the market? Sovereignty, if you will, is what some economists like to say. It's not that the suppliers can just come in and just give us whatever they want and charge us whatever they want and do whatever they want to us, that we really do have a little more power, don't we, Ed?
Absolutely. Absolutely. And I think, some of it is some misconception about licensing versus regulation. I think, for a lot of folks, they mistake and they think that licensing is the only way, actually making it illegal for somebody to give somebody a haircut or to style somebody's hair without meeting these state mandated minimum requirements. When you and I both know that there's all different ways that we can regulate. And one of the best regulators, as you mentioned, is the market itself. Mm-hmm. The market's going to discipline poor quality providers. If I'm a barber or I'm a cosmetologist and I'm providing poor quality service, or I'm continually injuring people, I'm not going to be in business for very long. The market's going to discipline me. And of course, now today, that market gets supplemented with online reviews that, people can receive feedback about other consumers' experiences. And it makes the traditional or historical regulation and very onerous regulation of occupational licensing seem obsolete. And, in between the market and occupational licensing, making it a crime to do the job without meeting these bare minimum entry requirements, there's a whole host of additional other options as well. The private market itself can issue a credential. You can have private certification. So if I want to have some information as a consumer about whether or not this professional has gone through some amount of training, I can check to see if they have a private issued credential, a private certification. I don't have to rely upon the state. I don't have to rely upon it being a crime for an individual to do the job. And it doesn't preclude people who maybe don't care so much. There's certainly individuals that might not necessarily care if an individual has gone through this private certification. They might be interested. They might just trust the reputation of the seller. And with licensing, I mean, it's a crime to do so, to seek out that service. So it's limiting consumer options. It's limiting choice. And I think it just needs to be clarified that licensing is not regulation. That there's all different ways, much less costly ways to regulate that don't involve issuing a license.
Yeah, that's a great point. And like you said at the beginning too, markets are probably the best way, or I think they are the best way. Not probably, they are the best way to regulate, because then you let the price system determine whether or not you want to use it, along with, Yelp, all these other reviews like you mentioned that are online now. We're in a whole different economy, a service economy, if you will, compared to back in the day when maybe licenses might have provided a signal, more value than whenever you couldn't go online and just check it out. There were other ways to do that, of course, but nowadays it's like, come on, we're in the 21st century. We don't need all these regulation or licensing in this form of keeping out competitors in the marketplace. And it's interesting too, Ed, something about like the cartels of the licensing boards, where they set the criteria. Here's the amount you're going to pay. Here's the time that you've got to have in order to get that license. And unfortunately, the ones who maybe would take on those jobs, or maybe could need to take on those jobs the most, maybe the lower income folks, those with lower level skills and things of that nature, they can't. And maybe they don't have the time with their family and kids and other things that they need to do in their daily life to meet those requirements, yet they might be really good at that. Whether it's a plumbing or in this case, cosmetology, they might be really good at it and not need these additional costs. But maybe you could explain a little bit more about how these boards work. Why do they have so much control over some of these labor markets?
Yeah, no, and that's an excellent point. And I think a lot of it comes back to an economic theory of concentrated benefits and dispersed costs.
Yeah.
Those that are on the licensing board and those in professional associations, they have everything to lose from any change to the status quo. They want to keep it so that cosmetologists, in order to begin working, are going to need to complete as many as 1,800 hours. There's still a couple of states that require aspiring cosmetologists to complete 1,800 hours of education and training.
Wow.
And the folks that are sitting on the licensing boards could very well be owners or have some sort of financial ties to the schools that benefit from having this steady stream of customers because of licensing laws. And all of those folks, all of those aspiring cosmetologists and people that, as you mentioned, could very well be very good, but don't have the means of essentially stopping working and committing themselves to 1,800 hours of education and training to become a licensed cosmetologist, the legislators don't hear from those individuals. Those individuals, and you and I as consumers, the cost to us is relatively small. We have to pay a little bit more for a haircut. We don't have as much choice. We don't necessarily want to take the time to be talking with our local legislator and letting them know that we're not happy with the status quo. And those individuals that are on the sidelines, they probably don't have the means or the time to do so either. Yet, these folks that are on the licensing boards or these folks that own schools, it's everything to them. So they're going to throw all of their resources into keeping things the way that they are.
Mm-hmm. Yep. That's exactly right. I was just doing the math on that real quick. For 1,800 hours, if you divided that by 8, let's say you worked 8 hours a day doing this, it would take 225 days, Ed, to get a cosmetology license.
That's right. I
mean, that's just ridiculous. Ridiculous. And, I remember we've done some work here in Texas, and I think it's right around, it's a ridiculous amount of time. But one thing that we pointed out was that a cosmetologist would need to take more hours to get that license than an EMS would. Someone who, emergency medical service, someone who is actually saving your life in many cases, would take less time. I forgot the exact number of hours. I have to go back and look at that. But it was much less time than a cosmetologist. It's just mind-blowing, the kind of situation that we're in. I wonder, Ed, like with your work on this across the states and doing research in this area, do you find that there are cases or broad cases where these occupations that are licensed, like the license actually improves the quality, it improves the situation compared to what it otherwise would be?
There are a couple of studies, and they're really historical studies that looked at licensing at the turn of the 20th century. So, this is like early doctor licensing, early midwife licensing. There are a couple of studies that do find some positive effects, and it's comparing licensing to no government or no other form of regulation. So that's the comparison. But if we look at more modern studies and we turn back to that Obama report and augment the summary of the Obama report. Like we did in the report that we put together for the Texas Public Policy Foundation, we found that only 17% of studies found any evidence whatsoever that licensing was having some sort of positive quality effect. So certainly today, And again, given the fact that the market has changed, as we talked about,
Yeah.
it's not really clear that licensing is the right regulatory tool. And we know all about the costs and the consequences of it. That's very well documented.
Yeah. Yeah. And I was just looking at our report that we put out last year. This was our second report that we wrote together, but this one is titled, this is titled "Licensing Should Not Be Bigger in Texas: A Roadmap for Licensing Reform." And so you're right. So effective licensing on service quality from this kind of meta study here was 17% positive. So improvement they found of 17% in that literature of 30 studies that were done. Negative, so meaning declining quality in 13%. So not too much different than the 17%. And then no effect, 70%. Of those studies, right? Published studies, right? Were no effect. I mean, it's just remarkable, even though there are high costs to getting a lot of these licenses. And I did find, so barbers and cosmetologists in Texas must complete 1,000 clock hours of training and pass exams to cut hair. Now, this is down from the 1,500 hours due to legislation and newly adopted rules that were in 2020. But still, it's 1,000 clock hours, whereas I think for EMTs in Texas is right around 350 hours. So about 3 times the amount of time that they got to take in order to get a cosmetology license. It's just something else. And so, trying to play devil's advocate here, though, Ed, is you have some situations where I think people are concerned about these different markets, especially when it deals more with your health than maybe your hair. I think that is mainly driven by the boards, by the fiefdoms they like to create to keep barriers for people to get in. And so that way it keeps them there. Because, of course, if you keep supply down or limited compared to what it otherwise would be, you're going to have higher prices or higher wages in this case than you otherwise would have, which hurts the consumer and things of that nature. But something like doctors, okay, physicians versus a nurse practitioner. I've gotten some of these debates with some friends and family members and stuff, and there is an argument out there that the nurse practitioner, while they may be educated in certain areas, they don't have all of the time, the on-the-job training, if you will, to have the practice to make the best decisions on the fly. And so I think from their perspective, is that scope of practice should not be expansive for nurse practitioners compared to physicians, because we're not going to see the same types of results for people. But I wonder, from your research, and I know you've looked a lot at this, what do you find about the differences here?
Yeah, no, and it's an excellent point. And I mean, I think if you are going to make a case for licensing, perhaps doctors is a case where, you have a good argument. I mean, I think there's excellent arguments on both sides.
Yeah.
But, when it comes to the issue of scope of practice and looking at nurse practitioners in particular, this is a subject that's been studied extensively. Mm-hmm. And, I in fact, co-authored a book chapter that came out a couple of years ago with the Upjohn Institute. And, we summarized everything that we know about allowing nurse practitioners to work to the full extent of their training. And, what we find is that in states that move to allowing nurse practitioners to work more independently, to work without collaborative practice agreements, just, essentially a piece of paper that says, and I want to be clear that it's not true in any state that a nurse practitioner has to be monitored and closely overseen by a physician. That's not the case in any state. Okay. What we have today is a situation where in some states, physicians have to enter into contracts with nurse practitioners, and the nurse practitioners will pay the physicians for those contracts. And occasionally, depending upon the arrangement, they might look at some charts, but they're not going to be over the nurse practitioner's shoulder. Nurse practitioners are working independently in every single state. But with the rules and restrictions, nurse practitioners can become tethered to physicians, and they might not necessarily have the ability to go out and work independently. And, of course, there's issues with people getting access to care, particularly in rural parts of the country. And nurse practitioners could very well play more of a part in providing that care. But getting back to the literature, there's no evidence that if you don't force nurse practitioners to enter into these contracts with physicians, that the quality of care goes down. There's a handful of studies that find there's one very, very well circulated study that looks at nurse practitioners working in the emergency room. That's one exception.
Okay.
But the rest of the studies that have examined this issue find no evidence that nurse practitioners are providing poor quality of care. The argument that often gets made is that nurse practitioners are going to work beyond their scope, that suddenly they're going to do more. But I mean, my own understanding and my own experience in talking with practitioners is they're pretty conservative. I mean, they don't want to expose themselves to liability from doing things that they're not trained to do. If they feel like they're above their head, they're going to delegate.
Yeah.
And nurse practitioners, even if they're working independently, they're going to delegate to physicians if they encounter something where they don't feel comfortable. They're going to refer them to a specialist. They're still going to work in a setting where essentially, if they don't feel comfortable, they're going to refer them to somebody who can help them.
Yeah.
But that's a minority of cases. I mean, in most cases, nurse practitioners are more than capable of providing treatment. And certainly, I think giving patients access to nurse practitioners is better than not having any practitioner.
That's certainly true. And from what I could tell here in Texas and many other states is that there is a growing shortage of doctors and nurses. And this is one way in order to unleash the supply of those who can help patients. And so it would seem to me that legislatures across the country should be looking at as many ways as possible to open up that scope of practice so that way nurse practitioners can do what they do best. I mean, it goes back, I think, Ed, to Adam Smith when you think about division of labor and specialization. I mean, there's a need for the supply so we can see the pie start to grow, the number of physicians that could be out there doing this. And when you think about the division of labor, and to your point about nurse practitioners not wanting to cross that line to go too far for liability reasons, or it's just, it really is out of their scope of practice. But if they can do everything else that's in there, why not? Because that will help us to alleviate a lot of this shortage of doctors, help patients better. And those nurse practitioners, let's start there, can go in, do some of the minor things. And then that way the physicians, the doctors who have more training and everything else, they can do the bigger things that are more consequential to people's lives. And we might have a better healthcare system. Couldn't that help some of that, Ed?
Absolutely. And I think too often the mindset is it's a turf protection. I got to protect my piece of the pie. I don't want to give up my piece of the pie without thinking about growing the size of the pie or just making the pie more lucrative. Getting a little bit more out of each slice. So absolutely. I mean, division of labor is relevant, and physicians can focus on more high value added services and allow nurse practitioners to treat more of these more everyday strep throat. Strep throat's going around in my household, and I'm sure everybody else's household. Just making sure that people have access to the care that they need. And even if, and like you said, we should consider any and all options. Even with physicians, there's this terrible bottleneck of physicians getting matched for residency. So you have these physicians who are sitting on the sideline. They've completed all their education and training. They just haven't been able to find a match to complete their residency. And there's a handful of states, Missouri is one that sticks out, that have allowed physicians to work even if they haven't completed their residency. They call them assistant physicians or associate physicians. And at the very least, rather than letting those physicians just sit idly or, maybe drive Uber or, do something that doesn't align with what they've been trained to do, get them out there and let them work under another physician, or at the very least provide some primary care, rather than putting that resource to waste. I mean, we need more healthcare professionals, and we should be looking at any and all avenues to expand supply.
Yeah, amen. I agree. Going through some of the other kind of literature on this topic, because I think it's really important. We've kind of went through, okay, here's what occupational licensing is. Here's why it's important. But something else that I think can grab people's attention to really get at how consequential that this is some of the research that's been done in this area. So Kleiner and Borotnikoff estimate that licensing results in the loss of almost 2 million jobs nationally. 2 million jobs. There's also some studies out there, Blair and Chung, Kleiner and Soltas. Kleiner's done a lot of work in this space, a lot of good work. But occupational licensing reduces employment in the licensed professions by 27 and 29%, respectively, whenever you're looking at the work that each one of those authors have done in those papers. And I know for you, this Kleiner and Kruger paper finds that occupational licensing inflates wages for those who are licensed by up to 15% on average compared to what otherwise would be. And then you've looked at massage therapists, optician licensing, how those also inflate at a similar sort of amount and so this really raises the prices, because if the wages are then going to be higher, it's going to come on to higher prices on all of us. And we just mentioned how the quality of the licensed professions isn't increasing. 70% really show no effect. So we get the higher costs, but we're not seeing the better gains from it at the same time. And so this really crushing, a lot of consumers from really benefiting from a lot of these other occupations that are out there, while keeping some of those people out who could find a job in these areas and really help to reduce the poverty rate and everything else. I think one issue that I have, or question I have for you, Ed, is when you're going across the country, and I know there's a lot of job openings compared to people who are unemployed today, but it's interesting to me, I don't know if you've looked at this, how many of those areas are licensed professions where the openings are, where they just can't do it because they don't have the license yet?
Yeah, I haven't definitively looked at what that breakdown is, but generally when I'm speaking with policymakers, or I put together pieces for opinion pieces and such, I mean it's very well publicized that there is this ongoing labor shortage, that employers are having a hard time recruiting folks, and I mean I think licensing is no doubt playing a role. As you mentioned, we know that occupational licensing reduces labor supply. And if you're mandating one particular track for individuals to begin working, you're going to discourage folks from working. We know that the pool of labor has changed. We know that many people are reconsidering whether or not they want to go to college. So I think it's important to make sure that people have access to alternative pathways, whether that be apprenticeship, whether that be on-the-job training. I think I'd open up these avenues so that employers have access to the workers that they need. We don't want to have a situation where employers can't recruit people, because, I mean, you and I both know as economists that if employers aren't able to recruit workers, then we're not going to have as many goods and services produced, and we're not going to be as prosperous as a society. Yep. It's just unfortunate that in the case of occupational licensing, as you mentioned, we have this mountain of evidence that licensing is clearly very costly. We have scant evidence at best that occupational licensing is improving quality. In fact, it's much more heavier on the null effect, or negative potentially. Yet it persists, and it continues. I have some reasons to be optimistic, but At the same time, it's a difficult nut to crack.
Yeah, it certainly is. And speaking of optimism, though, as we're wrapping up here, Ed, I think that there have been some key reforms that have happened across the country, and you've been instrumental in proposing, recommending reforms to happen across the states, because that's really where this is done. It's not really done at the federal level. Not much done at the local level. It really is at the state level. And so what have you seen that's been going on across the country in some of these key reforms? And what are kind of your best recommendations for how we should move forward?
The one area where I'm most optimistic is the tension that licensing creates when people move. I mean, licensing generally does not transfer. If I'm licensed as a certified public accountant in West Virginia and I move to Texas, my license will not automatically move over with me. So one reform that we've seen now in 21 states in varying amounts of effectiveness and breadth is something called universal recognition. And the state, I think, that really illustrated how to do this right first was Arizona. Mm-hmm. Arizona passed this reform in 2019. And, essentially what Arizona said is that if you have a license in good standing, we'll accept your license. You don't have to meet Arizona's requirements. We'll trust that other regulators have evaluated you appropriately. And that seems to be an area where there's more and more interest. We as workers are moving more. Certainly military families have a tendency to move a lot more than civilians do. So making sure that licensing isn't keeping people out of the labor market just because they move, and they don't suddenly stop being able to do the job that they've been trained to do, and that they've been doing perhaps for decades, just because they moved from one state to another. So that's one area that I'm most optimistic about, with respect to breaking down that specific friction that licensing creates.
Yeah. Yeah, and I guess other ones have been kind of the right to earn a living sort of legislation that's been passed. You can bring forth it kind of turns the demand on the government instead of you on why you need to have that license. I think that's an important step that hopefully others will take. I know other ones have been kind of, you're in the military. It kind of goes back to your point about moving. But if you're in the military, that you would also be able to have kind of this recognition in other states. Mm-hmm. I think that's another good one. I think kind of really wrap it up here now. As a free market economist, myself, and I think you too, Ed, I really think the market works best at the end of the day. I think that is counter to what a lot of people believe, and it really hits them. As we've been talking about today, I think that the licensing is more of a signal versus what the actual outcomes are from that license itself. And I'm so glad that you're educating more people about this and talking with states and getting reforms at the end of the day. Because, I mean, if I had it in my utopia, if you will, it would be to where there wouldn't be any licensing. I mean, it's a form of labor market regulation. Even for doctors, yes, there would be some cost to it, to where certain doctors, you would have outcomes that maybe we wouldn't like. People would die or something along those lines. But we have that today, too, when there already are licensed, because you've got to remember that these tests are only done once a year, or they're only given out at that point in time. It's not like it's done every single day to where they're being tested and everything. And so why not go ahead and have it to where it's an open market, and you could have lower prices, and you could have increased quality and things online, so you can pick and choose what you want to do. But I think for most people, Ed, that's probably outside of the box too much, that they really just don't know how to handle that. And I'm so glad you're working on what you're doing. And what do you kind of see for the future? Is it along these lines? Do you think we can really roll back a lot of these licenses, or what do you hope happens?
Yeah, I mean, I would like to see the Overton window shift towards more openness and more willingness to allow the market to function. Because I mean, even if we think about something like physician licensing, it's insufficient. I mean, it is not protecting us like we think that it does. There's all sorts of private credentials and board certification and operating room privileges that do a better job, frankly, than what doctor licensing does. So, I would say that my hope is that as more people become aware and have this understanding that licensing is not the only answer. Licensing is instead the most costly answer. And, it's costing all of us in terms of the price that we pay for the services that we enjoy. It's costing us in terms of lost opportunity, people not being able to work to their fullest of potential. And, my hope would be that as awareness grows and, perhaps as more folks learn about, what occupational licensing does, that there will be more openness to reform.
Yeah.
Certainly, I hope that in my lifetime, we see barber and cosmetologist licensing go away.
Yeah.
In the United Kingdom, they don't have it, and there's other wealthy countries that don't have licensing for these professions. So you'd think that there would be some learning that happens over time.
Yeah, definitely. So at the end of the day, what you're saying is occupational licensing doesn't let us prosper like we would.
That's absolutely right. It's preventing us from prospering.
Yeah, we can't have that. This is the Let People Prosper show. We got to have prosperity.
That's right.
Hey, Ed, it's always a pleasure talking with you, and I appreciate all the work you're doing. Keep it going, and God bless you and your family.
Thank you. Same to you, Vance. Great chatting with you.
Hey, you too, Ed. Well, thank you, Ed, for being on the show. For the audience, please go and give us a 5-star rating if you like this, wherever you listen to this podcast, and share with your friends and family. They might like it too, and learn a little bit about occupational licensing and cosmetology and why you're paying so much for all this stuff. So I hope you have a great day, and until next time, let people prosper.